National Eye Institute Eye on the Future Video Contest 2022. Meenakshi Ambati, first place.
Hello, I'm Meenakshi Ambati from Charlottesville, Virginia in the United States, and I've discovered a potential treatment for a disease that causes blindness in millions of people worldwide.
Blurry photo of text. Macular degeneration is a thief of vision.
Atrophic macular degeneration, or dry AMD, is a horrific blinding disease that can rob a person's ability to read, see faces, be independent, and even their very humanity.
Macular degeneration, an epidemic of its own. Graph, Alzheimer's, prevalence approximately 50 million people. Cancers, excluding non-melanoma skin cancer, approximately 45 million people. Macular degeneration, approximately 200 million people. ADI World Alzheimer Report, 2019, WHO IARC GloboCan 2018, and Wong et al. Lancet Global Health 2014.
It affects 15 million Americans and 200 million people worldwide, more than the number of people with Alzheimer's and most cancers combined. Almost every family has a parent or grandparent with dry AMD, but sadly there's no treatment. Dry AMD affects the macula.
Schematic of eye with close-in view of macula, a spot on the retina. Macula includes photoreceptors sitting above RPE.
The macula is the center of the retina that enables 20/20 vision. The retinal pigmented epithelium, or RPE, is the layer most affected in this disease.
Inflammasome, a convergent integrator of dry AMD stressors. AlloRNA, A-beta, and iron point to an NLRP3 complex with caspase-1 and ASC, arrow pointing to RPE degeneration. Source Tarallo et al., Cell 2012, Liu et al., Investigative Ophthalmology and Visual Science 2013, Gelfand et al., Cell Reports 2015.
In dry AMD, toxic molecules such as AlloRNA, amyloid beta, and excess iron accumulate in the RPE. They cause RPE degeneration by activating a multi-protein complex called the NLRP3 inflammasome. Over the past 20 years, hundreds of clinical trials for this disease have failed. So, I made this huge unmet medical need my focus, and I discovered that the antidepressant drug fluoxetine, also known as Prozac, could be the solution. It could become the first drug approved for this blinding scourge. Using molecular modeling, I determined that fluoxetine binds NLRP3.
Molecular model of FLX NLRP3 binding, showing fluoxetine bound in a pocket inside a ribbon model of the NLRP3 protein.
Fluoxetine also completely blocked RPE death.
Fluoxetine blocks RPE degeneration. Confocal image showing small even layer of RPE cells in normal eye. In dry macular degeneration model, control therapy shows large misshapen cells and gaps in RPE layer. Macular degeneration model with fluoxetine shows normal RPE layer.
I also analyzed 3 health insurance databases of 130 million people and found that people taking fluoxetine had a 17% risk reduction in dry AMD. That translates to tens of millions of people worldwide who wouldn't develop it if they took fluoxetine.
Drug discovery and development timeline. Stage 1, drug discovery, 10,000 compounds. Stage 2, preclinical development, 250 compounds. Stage 3, clinical development, 5 compounds. FDA approval, 1 compound.
And compared to traditional drug discovery that has high failure rates,
traditional drug development is long and costly. Time from discovery stage, identifying target, then compounds, establishing activity, and selecting candidates, through the development stage, testing safety and clinical trials phase 1 through 4, is 12 to 15 years and $3 billion.
Repurposing fluoxetine for dry AMD can also shave years off the time and billions off the cost.
Repurposing can shrink time and cost. Time from phase 2 clinical trial through phase 4 is 2 to 4 years and $10 to $100 million.
I recently published these findings in the Proceedings of the National Academy of Sciences.
Ambati et al., October 7, 2021, identification of fluoxetine as a direct NLRP3 inhibitor to treat atrophic macular degeneration.
And I'm hopeful that other scientists will be able to expand upon this work. Communication is crucial in the scientific community to ensure that we can build upon each other's findings and make the world a better place through scientific progress. And my invention of using fluoxetine to treat dry AMD has been licensed to a biotech company which will launch clinical trials. My discovery is even more exciting because many other diseases are also driven by the inflammasome. Alzheimer's, multiple sclerosis, arthritis, and diabetes affect billions of people around the world, and it's tantalizing to consider repurposing fluoxetine to rid the world of these scourges too.
Inflammasome drives many disorders: Alzheimer's disease, Hennecke, Nature 2013, icing, Nature 2019, multiple sclerosis, Call, Nature Medicine 2015, atherosclerosis, Duell, Nature 2010, arthritis, Van de Waal, Nature 2014, obesity and diabetes, Badan Magzar, Nature Medicine 2011, and Jordan, Nature Medicine 2013.
Thank you very much for your interest in my project. Stay well and be safe.
All images created by Meenakshi Ambati, music by Bensound. National Eye Institute, www.nei.nih.gov. Video produced by Meenakshi Ambati, captioned, edited, and audio described by NEI.